Okay, hi. My name is Juniper Brand, and this is my strength and conditioning program for scapular winging. Okay, so a little bit of background on my athlete. My patient athlete is Josie Arnold, who is a high school student and sports med student. She's had a really long history of scapular winging, which I am trying to improve so she can improve her athletic abilities and also improve her everyday activities because it impacts everything. Okay, so some background on what scapular winging is. Again, scapular winging is basically when the muscles surrounding the scapula and of the scapula are too weak and or paralyzed, which results in a limited ability to stabilize the scapula, which in turn causes it to stick out from the back and creates this winging effect. Um, yeah. Okay, so like I said, we should improve scapular winging because it can lead to pain surrounding our shoulder. It can decrease our strength and stability in that area, which can lower our range of motion. It can be uncomfortable to the surrounding muscles and can limit our athletic abilities, which ties again into decreased strength because, strength and range of motion, especially for sports like softball and baseball, which is what Josie does, um, it makes it hard to play those sports because you need range of motion and strength in the shoulder for them. Again, tying into what the goal of this program is, it is to reduce Josie's scapular winging and improve her shoulder stability, which will lead to an overall better and more stabilized shoulder for her sports like softball and her everyday activities because, like I said, it can impact more than just sports. Okay, so looking at these, I guess, baseline measurements slash just pictures, you can obviously see here that Josie has a lot of scapular winging happening in both shoulders. The light's coming from over here, so it looks like there's more on her left, but they're honestly both pretty close. There's a lot of scapular winging happening. Um, and over here, you can tell I tried to sort of measure it throughout this program. This would be improving by using this program. Okay, moving on. Here's a little preview to my program, which I'll go more in depth and show examples of in a second. Here's my program. Um, yeah, let me show more. Okay, so to begin her strength program, I have scapular push-ups. So basically, these work on the muscles surrounding the scapula and work to hold it down, as will all of these exercises. Basically, what I did is I have here is sort of a progression. So at the beginning of the program, Josie's doing these on the wall, and then as she gets stronger, she's going to move to an elevated surface, and then as she gets stronger again, she's going to move to the floor. So here's them on the wall, and then on an elevated surface, and then on the floor. And to continue this idea of progression, I have plank shoulder taps, which does sort of the same general idea. It works on those muscles surrounding the scapula. It'd be the same idea of starting on a wall right here, then working towards an elevated surface, and then on the floor, as shown here. It's pretty simple, but these simple exercises actually do quite a lot for the specific injury type thing. Okay, so continuing into all of these exercises, here we have to begin is weighted shoulder elevation. This again is sort of doing the same thing as scapular push-ups, but it's could even be prior to her doing them on a wall because this is less weight because it's not her entire body. Same idea. Here we have lateral side raises, which more works like the deltoid, but it still is feeding into this idea of working the scapula. And then over here we have band, I guess you could call it clockwork because as you can see, the band is right here and she's moving her arms in and out, which is creating, tension in the shoulders, creating more muscle tension and work. And then finally, banded wall slides, um, which is obviously strengthening her muscles in her back and shoulders. Okay, so to sort of conclude, here's what her improvement comparisons would look like in a long time after she started using this program for a while. And if we had used this program just a bit more throughout these 2 weeks, she would probably go from something like this to something closer to this. This isn't necessarily a perfect picture to compare with because she isn't making the same movement. Josie's doing a, winged scapular test here, but this woman is not. But regardless, this would still change a lot with the use of this program throughout the course of, however long she would use it for. If Josie was to use this as a pre training to something like softball, she'd obviously have a lot more stability for that sport and other things and whatnot. And yeah, thank you for watching my program.